Good morning to doctor and friends. We are from Group 4 Team A and today we are going to present on Case 1. Patient is a 4-year-old Malay male, BMI normal. During admission, patient complained of neck pain, joint pain, drooling of saliva, less active, poor oral intake for the past 2 days, and constipation for the past 4 days. Patient was previously admitted due to underlying acute lymphoblastic leukemia for the past 1 year. Current diagnosis of patient is grade 3 vincristine-induced neurotoxicity and possible ileus secondary to vincristine. And this is the past medical and medication history of patient. Patient was diagnosed with grade 3 vincristine-induced neurotoxicity. For subjective evidence, MRI brain of patient shows no specific changes to white matter. Patient has weakness and muscle fatigue, constipation which is common with the use of vincristine, other sensations such as neck pain and joint pain. For objective evidence, the power limb score is 3/5. Patient has positive Babinski sign which may indicate corticospinal tract damage.
Other patient diagnoses include acute tonsillopharyngitis, which are supported with sore throat and pain on swallowing. There is also score that has been assessed, which is fever pain and central score. This is the predictor for the streptococcus infections. Next is the possible ileus secondary to vincristine. Patient have no bowel output for more than 1 week, and this is confirmed through the abdominal X-ray that give the impression for intestinal obstruction. Lastly is to rule out the neutropenic sepsis. The patient is suspected with neutropenia as he's just received the chemotherapy on 26 September, which is 4 days prior the admissions, and the ANC count also spiking. However, there is no fever during the admission and no growths of organism through the CNS result.
There are a few drug-related problems in this case. Firstly is the inappropriate indication of some of the medication. For example, fluconazole, cefepime, and esomeprazole. This medication should be discontinued. Next is the inappropriate treatment for acute tonsillopharyngitis. This patient is prescribed with benzylpenicillin. However, according to a few guidelines, the first-line antibiotic suggested is supposed to be oral penicillin V. The next drug-related problem is insufficient dosage of gabapentin. The patient is only prescribed with 30 mg of gabapentin TDS. However, according to some of the guidelines, the patient is recommended to receive 70 mg as single dose on day 1, BD on day 2, and TDS on day 3 and onwards. Next is the dose of gabapentin should be tapered down before discontinuation. We suggest to taper down the dose to 20 mg TDS. Moving on to the insufficient dosage of paracetamol. The patient was prescribed with stat dose of 210 mg. However, the recommended dose should be 280 mg stat dose, followed by daily dose of 210 mg. The last drug-related problem is inappropriate frequency of lactulose. The patient is prescribed with 5 ml of lactulose at night. However, according to some of the guidelines, the patient should receive an initial dose of 5 ml twice daily instead.
For the management of grade 3 vincristine-induced neurotoxicity, syrup gabapentin 30 mg TDS was prescribed as recommended by guidelines, but without tapering dose. The use of gabapentin in pediatric pain is actually off-label despite its efficacy in adults, but it is also supported by randomized controlled trial and case reports to be used in children. Based on patient's weight, it is suggested to increase the dose of gabapentin from 30 to 70 mg and to taper off the dose to 20 mg TDS 1 week before discontinuation. IV cefepime 700 mg TDS was given for febrile neutropenia, but patient's temperature, ANC, and blood CNS result were all normal. He is not indicated for IV cefepime and should be discontinued.
For the management of acute tonsillopharyngitis not caused by bacterial infection, symptomatic treatments such as diaphragm throat spraying and paracetamol would be the best management to relieve the pain. However, we would like to recommend to increase the dose of paracetamol up to 280 mg stat as recommended by Drug Doses Fraction 2017. For the management of vincristine-induced constipation, as this patient has no bowel output since the 1st of October 2019, syrup lactulose 5 ml 2 times daily should be given early on, since it was recommended that all children receiving vincristine should be prescribed with osmotic laxative prophylactically. So, to prevent constipation in the next chemotherapy cycle, osmotic laxative can be given daily with an increased dose. But if there is still no bowel movement after 3 days, stimulant laxative such as pisacoline and Senau can be given, or just continue osmotic laxative in addition to stimulant.
Monitoring plan. For syrup gabapentin, the efficacy monitoring includes reassessment of pain score using visual analog scale pain assessment tool and parents' complaints during the patient's care. For the safety monitoring, we should monitor for the CNS-related adverse reactions as listed here. For syrup paracetamol, the efficacy monitoring is also the same, using the pain assessment tool and patient's complaints during patient's care. For safety monitoring, we must monitor signs of anaphylaxis or hypersensitivity reaction. For oral penicillin V, the efficacy monitoring is eradication of signs and symptoms of acute tonsillopharyngitis, whereas for its safety monitoring, to monitor any signs of anaphylaxis during first dose. For syrup lactulose, the efficacy monitoring is reassessment of patient's bowel output and also the regular cycle of bowel output. For the safety monitoring, we must watch out for abnormal bowel movement patterns, the patient's IO chart for fluid status, hypersensitivity reactions, and also excessive bloating or flatulence. For both of these drugs in the maintenance cycle chemotherapy, the efficacy monitoring is to monitor the disease progression through routine follow-up. For the safety monitoring, we must monitor the baseline values of the patients and also monitor for any toxicity symptoms and also sign of malignancies as stated here.